Hello again, everyone, and welcome to Health Center. I'm Lorraine Brooks, and I'll be your host for today's show. Today we're going to be talking about a topic that's not particularly fun or sexy, but it's very important, especially if you're over the age of 50, and that topic is colorectal cancer. Just to give you a little bit of background, I did some research with the American Cancer Society on their webpage, which is a good source of information in case you need some. And according to the American Cancer Society, approximately 102,000 new cases of colon cancer will be diagnosed in 2011. Also, approximately 40,000 new cases of rectal cancer will be diagnosed in 2011. I'm going to quote from them. Colorectal cancer is the third leading cause of cancer-related deaths in the United States when men and women are considered separately, and the second leading cause when both sexes are combined. It is expected to cause about 50,000 deaths during 2011. The death rate, which is the number of deaths per 100,000 people in the population, from colorectal cancer has been dropping recently in the last 20 years. And there's a good reason for that, and that is because people are being screened more often and polyps are being found earlier, which is a very important tool for detection. So on today's show, I've invited two guests to talk about prevention and screening and the topic of colorectal cancer. And my two guests are Maria Yamtov, who is the Director of Community Outreach here at S.U.N.Y Downstate, and also the Project Director for the Integrated Breast, Cervical, and Colorectal Cancer Screening Program, which is funded by the New York State Department of Health. Welcome, Maria.
Thank you.
And Isabel Rodriguez, who is our Cancer Prevention Coordinator here at S.U.N.Y Downstate. Good afternoon, Isabel.
Good afternoon.
Thank you both for agreeing to come on today's show. Maria, I'll start with you because I know you do a lot of work in terms of colon cancer prevention. And I know that we recently recognized and celebrated Colorectal Cancer Awareness Month here at Downstate. So not only is colorectal cancer the third leading cause of death in the United States, but it's also the third leading cause of death here in Brooklyn, correct?
Correct.
Why is that? Why are there so many deaths due to colorectal cancer?
I think I heard you say that there has been a reduction in cancer death, and I think people are afraid to go get tested. They're afraid of what they're going to find. And I think that early detection and prevention and getting screened early would be would drop those numbers.
You know, prevention and early detection is something we talk about all the time. And you would think that at this point in time, people would have gotten that message that it's important to be screened. It's important, even if you don't have symptoms or even if you're feeling okay, to still be screened.
Absolutely.
Are there any symptoms of colorectal cancer?
Well,
I mean, how would you know?
Right. So you could have no symptoms whatsoever and something can be brewing inside of you. And with early screening, that is the time to find these polyps or anything there that might start a cancer from growing and live a normal life.
What exactly is a polyp?
A polyp is a growth that happens at the lining of the colon. And it could be very, very small. It takes a long time for it to grow. Mm-hmm. But when we do the colonoscopies, which is one of the screening tests that is done for colon cancer, the doctor can actually remove that polyp. And you could prevent yourself from the challenges of having cancer.
So a polyp doesn't necessarily have to mean you have cancer.
Absolutely not. A lot of the polyps are benign and they mean nothing, but they still got to be tested in order for us to know if it's precancerous or cancer.
And you would have no way of knowing that you had a polyp unless you had a screening test, correct?
Most of the time you might not know. Sometimes you might have symptoms, gastrointestinal symptoms. You might have changes in your stool that may indicate that there's something there. But that is not, at that stage already, that polyp is much bigger than just a polyp. So the time to do it is early on.
We talk a lot about risk factors, and I know that having a risk factor or several risk factors doesn't necessarily mean that you will develop the disease, but there are certain things about your life or your lifestyle that might raise your risk. Can you talk about that a little bit? What are some of the
First
risk
of all,
factors?
as we age, we're all more at risk of developing cancer. Of course, family history, personal history of cancer will raise also the risk. Being overweight, eating a high-fat diet, not being physically active. So all the healthy lifestyles that we want to promote puts you at risk if it's not part of your life.
These are the things that we tell people about pretty much any type of cancer, isn't
Right.
it? Try to keep your
Absolutely.
weight under control,
Yes.
try to be more active and eat a diet that's low in fat and hopefully high in fiber.
Right.
Does fiber have any
Yes,
play a role?
absolutely. Fiber is very good because you want to avoid constipation, and constipation can be a risk factor also for developing some kind of cancer, of the colon.
So what exactly do you do? Maybe I should ask you this question, Isabel. What exactly do you do in the colorectal cancer screening program here? If I was a patient and I was coming in, what would be the first thing that you would recommend or that I would have to do?
Well, it all depends on whether you're a patient that has insurance or doesn't. First of all, the same care is going to be provided whether you have insurance or not. But the difference is going to be what program you go through. So if you have insurance, you could see your doctor at his private office and discuss it, or you could come to a larger facility like Downstate, which has the different specialties. If you don't have insurance, that doesn't mean that you can't have the screenings. So you don't have a primary care doctor perhaps because you don't have insurance, but you can still take advantage of the free screenings through this grant that we have in Maria's department. So the grant, you would contact us, and we'll provide the telephone numbers in a little while. And if you're eligible, either age eligible or if you have any high risk factors, as we spoke about, you will be assessed and enrolled into the program for the free screenings.
So that's important because, here in Brooklyn and I guess all across the country, we have a number of people who are uninsured or underinsured. And
Right.
of course, our population, we unfortunately have a lot of people who fall into that category. So I think it's an important message to send people that even if they don't have any insurance,
Yes.
that they can still avail themselves of this service, and
Right.
that shouldn't be a deterrent. So let's say, for example, I've been to my family doctor, and my family doctor recommends that I have a screening. What would likely be the scenario if I came here? If I said to you, I just went to my doctor and my doctor thinks I should be screened because I'm over 50. I don't like to admit that, but I am over 50. What should I do?
Well, you come in for some pre-admission testing. If you're going
What
for
would
a
that
screening
involve?
colonoscopy.
Okay.
That would probably involve an EKG to make sure that you don't have any heart conditions or that everything is stable. And Maria can correct me if I'm wrong. You would probably do some blood work, and they would just make sure that your pressure and other things are normal so that you can undergo the procedure. Again, that's if you're going for a colonoscopy.
Okay.
If you're going for a more simple procedure, like the stool-based test, you don't need all of those pre-admission testing.
Okay. So it's pretty comprehensive then. I would be screened to make sure that the test itself would go well. The colonoscopy would go well.
Right.
What exactly happens during the colonoscopy?
I think Maria should.
Okay. First of all, the colonoscopy.
Because I think, excuse me, I'm
yes.
sorry for interrupting, but I think that a lot of people are afraid
Right.
of the procedure itself. You know,
Right.
it sounds so
The
invasive.
colonoscopy is a very short procedure, and you go home the same day. It's the risk is very minimal.
So it's an outpatient procedure.
It's an outpatient procedure. Some doctors actually do it in their own office. There is some sedation, so you don't feel any pain. There's absolutely no pain involved.
Okay.
And all the tests that Isabel was talking about is really to make sure that you're in good physical health. That there's nothing, for example, your pressure is too high. You wouldn't want to do the colonoscopy with your pressure too high, or something like that. The test itself is involved putting a tube through your rectum while you're asleep. So you're not going to even see it. The doctor will be able to look through an eye and see how your colon looks, and also to remove any polyps that might be there.
Now, I'm going to ask you what might sound like a silly question, but just for clarification, colorectal cancer involves the colon and the rectum, yes?
Absolutely.
What is the difference between the colon and the rectum?
Okay, the colon is the large intestines. So the rectum is the opening into the colon. So it's the lower part of the colon.
Okay. So the rectum comes first,
Yes,
and then the
right,
large intestine.
Right. So when the doctor checks you with that tube, he's able to see from the bottom all the way to the top, where most polyps will begin.
And you're asleep during that whole procedure?
And you're completely asleep. It's not general anesthesia, so it's not as risky as general anesthesia is. It's like a moderate sedation. So sleep, and you're not going to remember anything. And before you know it, you'll be up and you'll be thinking, when am I having this done? So it really is a very not, I don't know what word to use, but it's not a procedure that is as horrible as it sounds when people tell you have to go for a colonoscopy. Yes, there is some preparation before to
What's
clean
the
your
preparation?
colon. There's different types, so I don't want to go strictly into it because depending on your doctor what they give you, but you do have to clean your colon. So in order to do that, they'll give you something to drink and some pills to take, so you could go and clean your rectum and your colon really well, and they'll be able to see well into
They'll be able
your-
to get a good
right,
picture
good
of
picture.
what's happening. I've heard people say that actually, that it was over before they knew it. They woke up and they were like, well, when are you going to start?
Right.
And the doctor said, well, we're already
We're
done.
finished.
So I think that's important to mention. I know that I'm a little bit of a chicken myself. I have to admit this. And I have not had a colonoscopy.
Ooh.
I know. And
We're going to
I'm-
have
I'm-
to sign you up.
I'm admitting this on the air because I think it's important. And yes,
absolutely,
I'm saying that right now. I remember when I think it was Katie Couric,
Yes,
or one of the
yes.
people on the Today Show, when she had hers,
Right.
and her husband, I
Wife,
think, had
yes.
had colorectal
Cancer.
cancer, and she did hers on the air, and I
Yes.
thought to myself, "Wow, that takes a lot of nerve to
Yes.
do." Well, I'm not going to do mine on the air, but I absolutely will sign up for one because I'm at that age, and I have a couple of risk factors as well. So I think it's very important.
I would like to also add that, as far as risk factors, we talked about some of them. Also, we talked about family history, meaning if a family member has colon cancer, rectal cancer, or any other cancer, puts you a little bit higher risk. Also, if you have Crohn's disease or colitis, or any of those diseases, you are at risk. So your doctor might want to start a little bit before 50. But we recommend 50 years old and over, but if you have a high risk, you might go a little bit earlier than that.
What kind of, we always talk about lifestyle changes,
Yes.
almost no matter what your issue is, there's probably a lifestyle change that will help mitigate some of the risk factors. What are some of the lifestyle changes that you might make even before you reach the age where it might become a concern?
Right. And there are simple things that you can do. So it can be as easy as getting off the bus or the train one station or one stop before and walking the
Now,
extra 2 or 3 blocks
Why
home.
would that
Well,
help me
Right.
prevent cancer?
So it's increasing your level of physical activity,
Okay.
which if we do enough will decrease your excess weight. So it will help you lose weight or maintain your weight.
Okay.
So that would be a simple step to start. So not everyone is, Planet Fitness and ready to go with the big muscles. So that's fine. If you
Okay.
take it one step at a time, just start a little extra walking. And with your diet, simple changes, such
Like?
as making substitutions instead of adding butter to certain things, maybe skipping the butter or not adding extra salt, changing to high fiber bread instead of regular white. Simple things like that. Low fat milk versus whole milk.
So, and these are the things that, as we said before, these are the things that we should all be doing anyway, right? I mean, regardless of whether we have risk factors or not.
Right.
So increasing your physical exercise in simple ways like walking. Everybody can walk, or most people can walk. Adding some fiber to your diet,
Right, so fruits and vegetables for sure.
fruits and vegetables, including more whole grains,
Yes.
whole wheat bread, whole grain.
Pastas, rice.
Okay.
Right.
And what was the other
Decreasing
thing you mentioned?
fat.
Decreasing fat.
Decreasing fat, decreasing the amount of red meat that you eat. Red meat, it has been shown that it increases your risk of colon cancer.
So what can you eat instead of red meat?
Well, you could eat chicken, but make sure or any kind of
Remove
poultry,
the skin.
removing the skin. You could have fish. Fish is very good to eat at least 2 to 3 times a week. And again, like you said, it's not just for colon cancer, it's for all the other cancers, it's for diabetes, it's for heart disease. So overall, it's living a healthy lifestyle.
So why, if it's so, not simple is not the, well, actually, it is simple, it's just not easy.
Right.
So if it's so simple, why don't more people do it? Why do we have to keep repeating this message?
Change is so hard.
Yeah.
You get used to doing the same things. If you find comfort in the way maybe your parents cook, then it may not be the healthiest way. My mother changed the way she used to cook, but for health reasons, she had no option. But we didn't realize how unhealthy we were eating until she started to incorporate more fruits and vegetables and cook with brown rice, for example. And it made a big impact. So even a small change, and it's not to say that you can't have any red meat, just maybe have it once a week or not every other day. So a simple change can really make the difference.
A lot of ethnic foods are unfortunately very high in fat and low in fiber.
Right.
Rice, white rice, but rice and beans, and I'm from the Caribbean, my family's from the Caribbean. So we eat a lot of rice and beans, rice and peas, but that's a good thing, right? Because the legumes are high in fiber.
Right. But it's also the way you cook it. It's not so much also the type of foods, the way you're cooking it, what are you using, and, if you're using type of oils that are, like palm oil, things like that, it will make it more fatty.
What should you use instead?
You should use olive oil.
Okay.
Things
Not butter.
Or not oil at all, but definitely not butter or lard or anything like that. Coconut oil is really not that good for you. So you have to look at the ingredients that you're putting it to make it taste as good as it does.
Exactly. Well, that's an issue here in Flatbush, where we are.
Right.
We have a lot of people from the Caribbean and Africa, and they eat a diet that's very different than the way we cook. So I know that sometimes it's difficult to convince people that they need to change certain simple things. So how do you work with people when they come in for our cancer screening, or when they are already cancer patients? How do you work with them to get them to change these lifestyle things?
I think what's important, it's very hard to change, as we all know. So I think it's making small changes, and I think Isabel mentioned that. I think, what are you willing to give up? Not to give up your entire
Nothing.
culture. Well, but if I
say that funny, but I
Right.
mean, there are people who honestly...
Right. But if they're willing, they have to be willing. If they're willing, they can still have the rice and beans, but can they change some of the ingredients that they put in it? Or maybe smaller portion
Or maybe the amount.
size.
Okay.
Or eating the meat less often, the red meat. Less frying, maybe broiling or baking. And I have seen a lot of changes, even in community members that from this neighborhood, this community, that are willing to make those changes, that are starting to make those changes.
That's good news.
Yes.
That's good to know. The grant that you have, it says for integrated breast, cervical, and colorectal cancer screening. So if you could mention the other two a little bit, since we're here talking. You do breast and cervical cancer prevention also. What exactly does that involve?
So for anyone who does not have insurance, the program is really focusing those individuals who either have lost their insurance because of losing their employment, or who are not eligible for insurance at the moment. So if you don't have health insurance, you can, if you meet the eligibility criteria, can get screened for breast cancer, which would include clinical breast exams and mammograms, for cervical cancer, which would include the pelvic exam and pap test, and for colon cancer, which would include a take-home colon cancer test, and if it's abnormal, you would go for a colonoscopy, which would be covered through the program.
And the program is funded by the New York State Department of Health.
Correct.
So I should say congratulations, shouldn't I? Because I'm sure that was competitive, and you had to come up with a good program in order to receive funding. Your title is Cancer Prevention Coordinator. What does that entail?
Well, that entails a little bit of what we've been talking about, making sure that people get the message that simple or small changes can make a difference, that early detection is important, and that they should get screened and speak with their doctors to find out when they should start getting screened.
What you mentioned mammograms. How often should a woman have a mammogram? And is it only women? Because men can get breast cancer too, yes?
Men can get breast cancer as well. It's
can
a very
men get
small,
a mammogram?
Men don't go for mammograms
Okay.
usually. Usually when men are diagnosed with breast cancer or are symptomatic for breast cancer, I don't know if they would go for a diagnostic mammogram.
They do ultrasound.
They would do an ultrasound, right, to
Okay.
determine whether it's cancer. But it's a very small percentage of the cases. But for women, although it's been a little bit of a debate lately, the standard is still 40 years of age. You should start having your mammogram. So it would be once a year, starting at age 40, unless your doctor recommends at a different interval.
Okay, meaning it could be
Meaning it
more
could be
often or
more often
less
or
often.
less often, correct.
What about cystic breasts? I hear a lot of people say that they have cystic breasts. What does that put you at a higher risk of developing breast cancer?
It's controversial about that, but just having cysts, which means fluid in the breast tissues, does not necessarily mean that that it is breast cancer or puts you at risk for breast cancer. They're usually benign. They should be checked because you don't know what it is until you check. So it might be nothing.
That would show up on a mammogram.
It will
a
show
cyst.
up, not always, it might show up in the mammogram or it might show up more in the ultrasound.
Okay. And what about self-exams? Obviously, you recommend. How often should you do a self-exam?
Well, the recommendation is still once a month for the self-exam.
Once a month.
And your clinical breast exam, which is when the physician manually examines your breast, that should be done on a yearly basis as part of your GYN examination.
Interesting, because I don't think I've had a clinical breast exam in a few years then. I must mention that to my gynecologist as well. Is that also true for men and women? Should men do self-exams?
Men should do self-exams because for men, it tends to be the case that they're a little bit tougher, like to go to the physicians a little bit less than the
often,
females, right? So if they feel a lump, they should really seek out some medical advice and make sure that it is not something that would lead to breast cancer.
How many men do you see
Through this program,
through this program?
we don't really see a lot of men,
Okay.
and the men that we would probably see would be symptomatic. So men that already have an issue and are kind of coming to us because they need guidance.
But we do see them for the colorectal
Right, okay.
in this program.
Okay.
Yeah.
Is there any difference in the incidence rate between men and women with colorectal cancer?
Yes, men usually
There's a
tend to
difference?
be higher.
Do we know why?
Not sure.
Not really. And African Americans tend to have a
Yes,
higher rate
absolutely.
too. We don't know why that is
Right.
either.
Might have to do with diet, or lifestyle. Also, we didn't mention smoking, but smoking is also a major risk factor for cancer. So
For colorectal cancer?
any cancer,
Any kind of cancer.
any kind of cancer.
So the message is stop smoking no matter what. No
And,
matter what.
You know, right.
Yeah.
If you need help, please call 311, you know, Department of Health, or you could even call Downstate.
We have a
And we
smoking
will
cessation
supply-
program
yes,
here, correct?
Yes, yes.
So smoking,
Diet,
diet,
physical
physical
activity,
exercise,
Screening.
age,
Early screenings.
early screening and detection, assessing your risk factors if you have a family history, if you have a first-degree relative. What is a first-degree relative? Mother,
mother,
father,
sister,
brother. Okay. So if you have a mother, father, sister, or brother who has any type of cancer, then that raises your risk factor. If you have you said something about type 2 diabetes.
No, I didn't.
No? Okay,
I
I'm
said
sorry.
I
I
would diet.
apologize. Okay. Diet obviously
Yeah.
helps with type 2 diabetes.
Obesity,
Obesity
obesity puts you at risk, yes.
puts you at higher risk
Right,
for
higher
cancer.
risk.
Boy, I'm telling you, you know,
Learning?
really, I am. I'm
Okay.
learning a lot, and that's good because I think I'm just, the typical consumer. I'm not necessarily a healthcare professional, so I understand things the same way I think that most people understand them. And I am learning a lot that it isn't just one thing. It's your entire lifestyle.
Right.
And if you make even small changes in your
Absolutely.
life, as you say, get off the bus one stop earlier, park your car
A block
further in the parking lot than you normally would.
Take the steps.
Take the steps instead of the elevator. So these are small changes that we can all make. I just want to give you an opportunity to mention the phone number in case anybody
Yes.
needs more information.
So for those people that don't have health insurance and need cancer screenings, they can contact the Cancer Services Program of Central Brooklyn at 718-567-1384 or 1385.
Very good. Thank you very much, Isabel and Maria, for
Thank
being
you.
on today's show.
Thank you.
And these are very important topics that I'm glad we were able to shed some light on it. Thank you very much for watching Health Center, and we will see you on the next show. Thank you for watching.